everybody. I'm Mona Lisa, and I want to welcome you to Parents with Incarcerated Children, a video series that concentrates on your needs, the things that you need as a parent while you have incarcerated children. I myself, as you guys know, have a child who is incarcerated. She may be 24 years old to the world, but she's still my child. And she is currently incarcerated in Pulaski State Prison in Georgia. And today we have some amazing guests with us because these women are not only powerful women, but they have their place in society that is definitely going to help us all. And so I'm going to put myself out there for all of you guys who need the help, and I'm going to ask the questions that half of you guys are not going to find your way to ask. And I understand why. Some of us don't have insurance. Some of us can't afford to do this. And some of us are just downright embarrassed and ashamed and don't even want to admit it. But today I'm going to dig deep for all of us, and hopefully this can help you. So I'd like to introduce to you, and if you would please raise your hand so that they know exactly who we're talking about, Dr. Dominique Remaker. She is a clinical psychologist, and she is with us today.
Yes, hello. Yes, hello.
And then I also want to introduce to you Mayumi McKinley. She is the founder of Epiphany Counseling, Consulting, and Treatment Center, and she is a psychotherapist.
Yes, yes. So glad to be here.
Welcome, ladies. Welcome, 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 welcome. First of all, I want to say thank you so much for coming on and taking your time to do this, because I do realize that giving back to society at some point in time is a requirement for all of us who have been given the call to, the mental health awareness world. So I want to ask you a few questions. And first, let's start off with a discussion regarding the prevalence of mental health disorders in prison and the jail system. And I want to ask you, why is it that so many people get incarcerated today and they're basically mentally ill, but for some odd reason, everything just goes undiagnosed and untreated? Why is that?
Well, to do some of the statistics on mental health in prison and jail systems, like I found that 56% of state prisons have mental health, like their inmates have mental health issues, and then 45% of federal people, individuals that's in like the rural prison system, they have mental health systems, and then 64% have in the jail system have mental health issues. So we know the numbers. However, it also depends on the resources or lack thereof in your state, county, or federal level. Now, depending on which state it is, it depends on how the money is allocated. I can speak for California and a little bit of Georgia. California, they have a strong mental health support system. I think they put a lot of money into their psychology department. Georgia as well, but more so on more like psychotic symptoms, and I'm speaking just from my own experience generally. But major depression, manic symptoms, psychosis, those are, and substance abuse are the most common mental health disorders that we find in prison, in jail, and federal level prisons. And if the lack of underdiagnosis depends on if you enter a county system that doesn't value mental health, then it's going to be a quick assessment. Like, are you seeing people that, they might say, like, are you seeing things that no one else sees? If they say no, and they stop there, that's only the surface. There's other things. There's depression, there's anxiety, there's substance abuse, there's other things. But if you're not taking the time to actually assess thoroughly, and if the resources are not there for that staff member to assess thoroughly, they're going to be undiagnosed.
Absolutely. And I'll speak from a little bit of a different in terms of people who go, and you can speak to this as well, Dominic, people who go in and out of the jail system. I think there's a lack of understanding as us as individuals just in society of understanding what diagnosis and what mental health is. So your little cousin is going in and out of jail, or uncle has been in and out of prison because of the poor choices that he's made, but nobody's really understanding what could be behind those choices. So is it depression? Is it anxiety? Is it conduct disorder if it comes to a child? Is it depression because that looks different in teens as it does in adults? So your teenager who is shoplifting, your teenager, and that's not the case for everybody, so I'm just speaking broadly, your teenager who may be displaying some depressive symptoms, which as a teenager is more aggression, which is more isolation or having an attitude, it's just kind of overlooked. So I think a huge aspect of it is the lack of knowledge of what these mental health diagnoses look like in day to day, because it's not like what we see on television. Not everybody is schizophrenic. Not everybody is hearing the voices or such of the extreme cases that we're aware of. But if I ask someone, most people who come into my office will say they're not depressed or not anxious. But then when I start to asking questions and getting to the symptomology, it's let me educate you on what this is. So I think a large part of it is just, like she said, the lack of resources, but definitely beforehand, before they even reach the system, the lack of understanding of what is mental health. What does that consist of? The symptomology is not all Hollywood. It's you and me. 1 in 5 people are diagnosed with a mental health disability, right? Or a mental health illness, rather. But all of us know, how many people do you know, right? So if we do the math, everybody is faced with a different mental health challenge, and just we're not paying attention to it, or we just don't know.
Right.
That's interesting. So let me play devil's advocate here, and let me ask you guys this, and whoever wants to answer, just answer. Um, Society would say, based on the statistics you just shared, Dr. Remiker, that would mean that over 50% of the people that are in our jails and prison systems are actually mentally ill. So does that mean that because they're mentally ill, that they should not have to serve time or be accountable or responsible for their crimes that they've committed?
So mental health is also a voluntary, I guess, program. We can't force an inmate to come talk to us. We can't force them to want to seek out our services, and they might not value even the available resources that are available. Sometimes prisons only have just group therapy, and some inmates want just individual therapy. Now, if you are at a prison that doesn't have what you're looking for, you're going to feel like I'm not getting my services or my needs met, which truthfully they aren't. However, if they feel like there's a stigma also inside the prison system that inmates who go talk to psychologists and therapists are crazy, or that's the crazy ward. They don't just go for depression and anxiety and I don't want to say normal, but normal symptoms that we all may have experienced. So if you're faced with the stigma in prison and the lack of resources thereof, you're not getting your needs met at all. So I feel that it's the agency's, I guess, job or duty to advocate and teach, their inmates what resources they have available and why it's important for every resource to be available, not just crazy,
And if I were to add on to what she's saying, in terms, does it mean that they shouldn't have to serve the crime? I don't think that's what it's about. It's about bringing understanding, so they have an understanding of where their behaviors and things stem from, so that they can learn how to cope with whatever it is in a more positive way. If they're in jail or prison, and I'm not, a lot of people, let's just say there's a lot of people in jail and prison that because of a choice that they made, maybe mainly because of the emotional state or the mental state they were in. So can we agree to that? And if it's something directly related to a mental health diagnosis, then if I can educate you on that and help you understand why you're feeling the way you're feeling or what some of your symptoms are coming from, and then teach you techniques and tools to deal with your unstable mood, to deal with the shame, something that you've dealt with, to deal with whatever it may be, then it increases the likelihood of you making better choices or dealing with your emotions in a more effective, more positive way. And so I think that they have to go back, piggyback to your question. I don't think it's excusing them for their behaviors or whatever crime that they committed. However, I think it's a different approach, so that if it's something that they can grow from, if it's something that they can change so that it doesn't happen again. So yes, and the situations are so different. So as I'm talking to you, I'm thinking of various situations that pop in my head. So I do think it is individualized, but as a blanket statement that you stated, just overall, do I think you should be able to say, well, I have a mental health diagnosis, I shouldn't do the time? I don't think that would be appropriate in every situation, but I think it definitely should be a something that's paid attention to by the system so that the people can get the services and the help that they need versus just throwing them in a place. So I hope, does that answer your question?
That absolutely did
Okay.
answer my question. So let me ask another question. What is the difference between, and this is for you, Naomi, the difference between a psychotherapist and a psychologist? What's the difference between you two?
Between me and Dominique here.
Yes.
I think essentially it's they're the same thing. Our education is different. So my master's was in I'm a licensed clinical social worker, and my master's is in social work, community health, community mental health basis. So social work is more so looking at the underprivileged populations. It's a holistic view in my training. We're looking at, you know, ethnicity, race, gender, you know, where the person is located, culture, how all of that plays a role into their mental health and into some of the adversities that they're faced with. And that's kind of how we're trained. I think with, and Dominique is speaking on this, with psychologists, it's mental health based. I know they emphasize, they look at it holistically. Just in social work, our main issue is looking at the adversity. So the prison population, those that are less fortunate, how race, culture, where you're from, what generation you are in the States, how all of that plays a role into your mental health and emotional health, specifically for me, since that was my concentration. So social work, you know, that's kind of the basis of it. The underdeserved populations or underserved populations.
For me, I have a 5-year degree, which is a doctorate in clinical psychology. And yes, I do perform therapy, but also I can do psychological testing. And, you know, my program is geared on research and psychotherapy. So it's an added, it's a different degree. And I guess it says, it's not, I guess, it says that, you know, you have you're an expert in the field, you know, and a master's, which I also have too. I mastered this level of training. So it's the highest level, I guess, but we do both perform the same type of therapy.
And I'm glad you bring that up, because I think a lot of people get confused. They're like, oh, I have to have a psychologist, so I have to have psychotherapist is a term for anyone who provides psychotherapy. You have people who are psychologists and got Dominique's degree, and they decide not to do therapy. They decide to teach, or they decide to do research. And then you have people such as myself, and people confuse social work. They don't recognize that as a social worker. You know, many social workers do therapy. They associate social work with DCFS, or the Department of Children and Family Services, taking kids away, you know, getting your benefits, or things of that nature. If you're looking for a clinician, it can be either or. It's just the training is different, but the goal and the theory and some of the treatment techniques are the same.
Ah, that's very interesting, because what I have found,
Mm-hmm.
you know, with all of the population who are, you know, who have families who have loved ones incarcerated,
Mm-hmm.
they constantly come to me to ask me, you know, what type of person should I go to? I'm so confused, because when I go to look, there's psychologists, there's psychiatrists, there's psychotherapists, they don't even know where to start. So what they do is they just shut down and use that as their excuse.
You
So
can go to any of them. So you have licensed clinical social workers such as myself, and if you're looking at people, they'll list their specialties. They're like on websites such as Psychology Today or GoodTherapy.org. The person lists their specialties. So whether it's a licensed clinical social worker, or LCSW, or psychologist, not psychiatrist, because psychiatrist with a T is the medical doctor. You go to them, you're going to get meds. And people often confuse that. So they're like, all they wanted to give me was a prescription. Well, that's what psychiatrists do. They give prescriptions. They're not going to sit and have one-on-one therapy for, you know, every week with you. Whether you see psychologists, that's okay. You also see licensed marriage and family therapists. So all of these are the same thing. People who can provide you with therapy, their training just may be different, or their specialty may be different. Maybe they're specialized in trauma. Some people only specialize in eating disorders. So you definitely want to look at the specializations and get someone that you really feel comfortable with, because that's important. So you meet someone, you build that rapport. That's the most important thing, of the most important aspect of therapy.
I think the number one thing besides, you know, cost of course, is finding your fit. So whether your fit is with a psychologist, or a psychotherapist, or a counselor, you need to find who's going to give me the best services that works for me. I feel that I can be honest with them, and I don't feel judged, you know, because we get trained to work with everyone. However, some people may not mesh well together. You know, like you just feel like they don't know me, or they're not getting me. And I think the fit is really important.
And what about the old cliche, especially from our African American community? And yes, I am African American, for all of you who are still asking that question. Yes, my dad is black and my mother is white. And according to, the way society is, 1/8 of black is black. So sorry, that's what I am. I'm sorry, guys. I get crazy with that, because it's like, why do people even care what nationality I am? Just hear the words that are coming out of my mouth. That's more important. But the reality is I was born and raised on the African American side of my family, and that is all that I know as far as my culture is concerned. And speaking, the question to you guys as in our culture, it is known to be a waste of time, if you will, to go see anybody who helps us in the world of psychiatry, because all that, this is what most of us are saying, all that we're going to do is go sit on a couch, and you're just going to let us talk, and you're not going to help us. You're just going to listen, and then just say, so what's wrong with you? So tell me what's wrong with you. So tell me what you think. And it's just a bunch of questions, but there's no interaction, there's no help, and there's nothing that really is exchanged. How can we overcome that stigma and help our people?
Yes, yeah, I've heard all of those. I don't want to. I'm not coming to pay somebody to tell me what I'm going to do. I'm not paying someone to tell me what to do.
Right. Makes no
But
sense.
I think the first, what you're describing, that is a certain technique in therapy. You do have some therapeutic interventions where it's the therapist sit there, and that's kind of that's their technique. And for some people it works, and for some people it doesn't. So if you're a person who wants more interaction, then like Dominique said, you have to find the person that's the best fit for you. What I would say is, have you tried it? Have you tried it? And have you tried it with someone that you feel connected with? Because there is that huge stigma of, I'm not about to sit on someone's couch and let them tell me, and them just asking. Now I'm a therapist. I'm going to ask you how you feel. That I would be totally wrong if I did it. So
right, because you're not a mind reader.
And what you think.
Yes, it's not what you feel. Therapists are not here. Let's break it, the stigma now. We're not here to tell you what to do. We can't legally. We're not here to tell you what you should do. We're not here to judge. We're not here to be fortune tellers and psychically tell you if you should stay with your husband or not. It's definitely an opportunity to be more in tune with yourself and invest in yourself, and help you to maybe make some correlations, make some connections that maybe you didn't make before, help you develop different types of coping or different ways of thinking. If you find yourself in the same patterns, if you're finding it hard to overcome a loss, or deal with a divorce or challenge in your life, we're here to kind of help you through that. We're not fortune tellers. We're not magicians. I wish my favorite line is, okay, so how you gonna fix it? How long is this gonna take?
Well, in 3 visits, we'll have you completely back to normal, and we'll erase all that you've ever gone through your entire life in 3 visits.
Right.
Yeah.
If I knew how to do that, I'd be a millionaire, and I'd be in line for whoever knew how to do that.
And I also, like, we are trained to use a variety of approaches. So someone might have a specialty in cognitive behavioral therapy, or humanistic therapy. However, we are trained to not necessarily stick to that model for every person. We have to be flexible, because there's not one form of therapy to fix you, me, or my you. We have to also just be like, okay, so this person might not benefit from CBT, so I need to modify my approach a little bit. So we are also adjusting to the client in the room as well. We don't use the same technique on each person, although some people might have similar backgrounds, but they might not work well for, just tell me how you feel all day, But so we're very flexible as well.
Okay, so ladies, each one of you in 30 seconds or less, okay, because we're almost out of time here on this one. In 30 seconds or less, starting with you, Dr. Remaker, tell me exactly what you do, who you do it for, and why you do it.
Like my position? I'm sorry.
Yeah.
So I'm a clinical psychologist, and I work at the forensic hospital in Georgia. And I do that because I enjoy working with the underserved population. I don't see these individuals as crazy. I really see them as people that really need help. That's what I do.
Miami?
I'm Mayumi. I'm the founder of Epiphany Counseling Consulting Treatment Services. I have the blessed and fortunate opportunity to work with adults, older population, younger population, and I get to change lives every day by doing individual, family, and group therapy. I get to help people have what I call aha moments. I get to transform the way people think, and I say I get to because I think it's truly a blessing. So I get to change lives, participate in changing lives, because I'm not doing it, they do the work too. I get to participate in changing lives, changing perception, and providing healing, hope, and hopefully some peace of mind, because I think that's something that we all are striving for.
Awesome. Thank you, ladies. So once again, I am Mona Lisa Johnson. I'm the founder of Parents with Incarcerated Children. And I want to thank these ladies today for joining me to talk to you guys about mental health awareness. And here's the bottom line. When I first got involved in having my daughter go to prison, I realized that there was something more I needed to do. And the first thing I did after I fought myself, I beat myself up, I went into great amounts of guilt and shame, was I found a psychotherapist. I went to therapy. It was going to therapy that actually helped me and brought me out of my conundrum of just craziness, of not knowing what to do or how to do or what's next, and feeling all of this. I could have done better. I should have done this different. Or what if I had done that? And what about all the good things that I had done? I had to weigh all these things out in my brain, and it was just overtaking me. So what helped me was when I went to go see someone. And so what I would suggest to you guys is that you no longer think of this as, some hocus pocus or something that doesn't work, or that you allow society's stigma to continue to overtake you and steal from you the joy you could be receiving today if you just go get help. And I don't want you all to fall into that trap saying, well, I don't have the money. I don't have the insurance. I can't do this. I can't do that because I can't afford it. Because if you go to our website, pwicus.org, pwicus.org. You can type in your zip code and up will come many different opportunities for you to get free therapy, free mental health, low cost, sliding scale, which means it's based on your income. Also, it can show you how to go about getting the insurance that you need, if in fact you qualify. Like in New York, you can qualify for $21 a month free insurance. It's not free, it's $21 a month. And with that comes 15 psychotherapy sessions or sessions with any type of a psychologist or psychiatrist or psychotherapist. It's really up to you. You can get 15 sessions. So don't use the excuse anymore that you don't have the money. Don't use the excuse anymore that our culture, meaning the African American culture, your Caucasian culture, your belief system, anything that you have that holds you back and stops you from moving forward. Don't use that anymore. Do what I did. Set yourself free and go get the help. Until we talk again, I want you to remember this, to enjoy life, because life is what you make it. Yes, we all have loved ones who are incarcerated. Yes, we all suffer on a day-to-day basis, but misery is a choice, and you have to remember that. Misery is a choice. And I'm asking you today, what are you choosing? Okay? Talk to you soon.